Well, good afternoon, everyone, again, and welcome to the Volunteer and Faith-Based Respite Learning Collaborative. As most of you know, I'm Jill Kagan, Director of the Arch National Respite Network and Resource Center. We have a really great meeting for you today. Before we get started, I want to just say, please feel free to say hello in the chat and be sure to let us know what agency and what state you're from. And also, if you like, please add what you're hoping to get out of participating in the Learning Collaborative today. As usual, I have a few announcements at the beginning, and then we'll get right to our presenters, and we'll save questions until our presenters have completed their presentation. And we should have plenty of time at the end for questions. And then also, I'm hoping that we can hear from you with any updates you might have about anything you're doing at the state level or local level related to your volunteer and faith-based respite efforts. I want to welcome all of you, especially those of you who may be new to the group. And I know there may be a few of you who are joining us for the first time. The Learning Collaborative usually meets quarterly. The last time we met was in May. But for those of you who are new, I wanted to make sure that you knew about the Arch resources that we have on the website on volunteer and faith-based respite. And you can link to all of these resources at that link that you see on the slide. And in a few minutes, I'll put that link in the chat as well, so you'll have it. Just to remind you all, we do have a volunteer respite manual that's up on the website. We have some hard copies, so if you really like what you see there, we'd be happy to send you a copy of the hard copy of the manual. In the past, I've talked about the Arch Innovative and Exemplary Respite Services Initiative. And through that effort, we have identified a number of volunteer and faith-based respite efforts, and their descriptions of those programs are up on the Arch website as well. We just announced about a month ago our new innovative and exemplary respite services, and there were several of them that were also focused on volunteer respite. We have, as always, our previous archived webinars on the topic. Many of you have been very generous in sharing your own state tools or programs that you've developed around respite in the faith community or volunteer respite. Those are up on the Arch website. And then, of course, the page on the website that links to all the recordings of past calls and any resources that we've shared in the past. Most importantly, I wanted to make sure that you all know about the National Lifespan Respite Conference. We're so excited about that because it's the first time we will have met in person since 2019. And we're really hopeful that we'll be able to do that safely and have a really great time. It's going to be in Madison, Wisconsin in mid-September. If you have not yet registered, this is important. Please note that early registration will end August the 15th. So if you're planning on attending, you don't want to miss out on the discounted registration fee. And hotel rooms also, the block, the last time I checked the block, there were only a few rooms left, and it may even be sold out already. But if you haven't reserved your hotel room, please do that as soon as possible too. The full conference program is up on the website. We have some really wonderful keynote presenters, including Allison Barcroft, ACL Administrator and Assistant Secretary for Aging, and also Jennifer Olson from the Rosalynn Carter Institute for Caregiving. They're doing some incredible work now around employed caregivers, and she's going to be leading a discussion around public-private partnerships to support employed caregivers. So you really don't want to miss that panel on the last day of the conference. And then for those of you who are Lifespan Respite grantees or primary partners, this is also important. I want to remind you to register for the Learning Symposium, which is essentially our Lifespan Respite grantee meeting. And those are for those state agencies that are implementing lifespan respite grants in their states and their state coalition partners. There's no charge for this meeting, but you do have to register separately from the national conference. So if you registered and paid for the national conference, there's another link here that you need to go to so that I'll know you're also coming to the grantee meeting on the 13th of September, which is the day before the full conference starts. Again, this meeting is by invitation only. It's only for our state grantees and their primary partners. If you think you're one of them and you did not get an invitation from Arch and from ACL, please let me know and I will forward that to you as soon as possible. I also, for those of you that are definitely coming, I want to also remind you about our session that we affectionately call our Bring, Brag, and Borrow session. During these sessions, one person from each state will share a highlight of their Lifespan Respite Grant or Coalition activities from the past year. And we'd really appreciate it if you could send us your topics for that Bring, Brag, and Borrow presentation and your slides by August 26th. And I will stop now to see if there are any questions about the conference or about the grantee meeting. You can feel free to unmute yourselves and ask the question or put something in the chat. Any questions? Okay, I don't see anyone. That means I'll see all of your BB&B topics on August 26th. Wonderful. So we are going to get right to our presentation. I'm really so pleased today to welcome our two presenters, Nichole Goble, who's the Director of Community Initiatives, and Derrick Goddard, who's the Community Care Corps Director, both of them with the Caregiver Action Network, which is one of the primary partners implementing the Community Care Corps program. Again, thank you both so much for taking the time today to speak with us about the Community Care Program. And for those of you who don't know, and you'll be learning more, but Community Care Corps is funded by ACL to foster innovative local models that support family caregivers, older adults, or adults with disabilities. And we're really excited today to get the most recent update from both of you about the success of these efforts and also where you are expecting the program to go in the future. So I will just go ahead and turn it right over to you, Nichole.
Thank you very much. Well, Derrick and I are very excited to be here to talk a little bit about Community Care Corps, dig in a little bit into what some programs are doing specific to respite. But I'm going to turn it over to Derrick to kind of jump us off.
Okay, thank you, Nichole. Well, let me first just introduce myself. I'm Derrick Goddard, and I work for Caregiver Action Network, and I am the Community Care Corps Director. Each of the partners have selected a director for Community Care Corps, so I'm one of those directors. If you don't know, Caregiver Action Network is the nation's leading family caregiver organization working to improve the quality of life for family caregivers. So we're in partnership with 3 other organizations, and we manage the federally funded Community Care Corps program. A little background with me is that I have experience in the federal, state, and local levels in program administration and grant management. I've managed court programs, service agencies, healthcare services, and some educational programs. So that's a little background with me. I started with CAN back when the pandemic first started. So, when we first started, there was a lot of, back and forth because of the pandemic, but the program is now running smoothly and strong, and hopefully it'll continue to run for the next few years. So next slide, Jim.
All right. And so I'm Nichole, and I am the Director of Community Initiatives. And so what I do here at Caregiver Action Network is I help kind of implement all of the various programs and help kind of launch many of our resources that we put together for family caregivers. I also do a lot of talking to family caregivers directly by presenting to support groups, many of which are connected to churches and other places of worship. Specifically to the C3 program, I've had the great opportunity to sit in on what are called the virtual site visits. So really getting an opportunity to hear from the various grantees about what they're doing with their programs and the way that so many of them have had to adapt and change a little bit in the services that they provide as a result of the ongoing pandemic. So that's one of the things that we'll be chatting a little bit about. But yeah, that's kind of Derrick and I's kind of role here at Caregiver Action Network and our connection to the Community Care Core program. If you want to go ahead and advance to the next slide.
Sure, you can go to the next slide. Okay, as you see, and I think Joe's already said this, the mission for Community Care Core is to foster innovative local models to provide volunteer non-medical assistance to family caregivers, older adults, and adults with disabilities. Again, when we talk about local models, obviously there's respite programs similar to what the work you do, but there's also friendly visits. There's also home repairs, home accommodations for people that need that. So there's a lot of different models that we have been testing out. The goal is to assist older adults with disabilities, maintain their independence in the community as long as possible. Next slide.
And I'll chat just for a moment about some of the partners that help us, manage and kind of disperse all of the subgrants and help these programs run. So of course there's us, but there's also the Administration for Community Living. There's OASIS, who is one of the kind of main folks on the program, Alterum, who helps with some of our metrics and kind of managing some of the reporting mechanisms, US Aging. So we really have a huge kind of group of folks that are coming from kind of different aspects of the aging and disability communities to really kind of oversee this program. Now, the US HHS Administration for Community Living and the Administration on Aging, so ACL, was awarded the 5-year cooperative agreement to a 4-team agency, which includes everyone on here. And what this has done is to what Jill spoke a little bit about at the beginning and what Derrick has mentioned, is that it's really allowed us to subgrant to a lot of different organizations that really have a touch on these local communities and are doing some really important work to make the lives of older individuals and persons with disabilities better. And so, they're really moving forward in creating these models that will be able to be replicated in different communities going forward. Next slide. So the target populations of these programs: family caregivers, older adults, and persons with disabilities ages 18 and up. And it's Community Care Core is really at its heart the opportunity for community organizations to use volunteers to address some of the gaps in existing basic supports for these target populations. And again, this is why it's really important that these volunteers and these organizations that are implementing these programs have such a stronghold on their local communities, because they're able to identify what those specific gaps and needs are. Community Care Corps provides resources, trainings, and the technical assistance, monitoring and administration, and more for the grantees. So we help them troubleshoot. We run learning collaboratives so that they can share their findings, things like that. The grantees' local model volunteer programs are community-based, and they offer such a wide range of non-medical volunteer services. And it's, of course, important to note the non-medical piece of that. Community Care Corps will not replace the important services that the home care workforce and other professionals provide to help individuals that are living independent in the community. It's really about, again, finding those gaps where those non-medical volunteer services can really make a difference. Go ahead and advance to the next slide.
Okay, on this slide, I just want to talk about some of the people we have received applications from, the variety of different locations, urban, rural, even tribal areas where we have received applications. In the first 2 years of funding, Community Care Corps has received first 126 applications, and then eventually 184 applications the second year, for a total of 310 RFP applications. And they came from 45 different states, the District of Columbia, Puerto Rico. And this year we have selected 33 grantees for a total amount of $2,008,500. And even currently, as we speak, we're in the process of our third year of reviewing applications. And we have a variety of different proposals that provide a lot of different local models. I would say that one of the things that has happened when we first started during the pandemic, a lot of the applications had a lot of in-person type models that they wanted to do. And what they had to do, they had to basically pivot, as you know, with regards to the pandemic. And then some basically turned into a lot of video and remote type services. And to this day, they have kind of had a combination of hybrid and in-person type services. And I think that's been one of the new innovations. I'm sure you all have had similar kind of things that have happened. The application process has been competitive, and we basically award funding in the amount of $30,000, anywhere from $30,000 to $250,000. And all the applications obviously could not be approved, and all the amounts that people requested could not be approved. But we have a leadership team that takes a look at all of the applications. We even have reviewers. I think Jill at one point was even a reviewer for our first year. So we're always looking for those innovative models to basically put out there and see which ones work most effectively. Okay, next slide.
So I'll talk a little bit about the 2022 grantees. So these grantees represent a diverse group, a cross-section of the nation. So as you can see on the map that Derrick covered, we're talking, lots of different kind of ground covered, rural and urban areas, suburban areas, kind of the whole gamut there. The grantees comprise of numerous types of organizations as well, including community auxiliaries, university-based clinics, area agencies on aging, neighborhood villages, government agencies, coalitions, hospitals, and social service organizations. The size of the organizations are also incredibly varied. You have some that are very large, such as St. Agnes Hospital, a member of Ascension Health, and then, which I believe that would be one of the largest of this group, and it's the largest nonprofit healthcare organization in the nation. And then you also have some other smaller community-based organizations in the mix as well. But grantees provide services to individuals of a variety of races and ethnicities, including Hispanic, Native American, white, Black, Asian, and Native Alaskan. And there are 2 grantees who specifically serve new Americans. So that's part of why it's so important to have that diversity in location and kind of geographical spread, so that we really are looking at really diverse populations that are being served by these programs. And if you want to go ahead and advance to the next slide.
Okay. As you look at the slide, the grantees that are highlighted in yellow, they specifically provide respite services. So I want to highlight those in just a moment. But before I highlight those particular 5, I wanted to give you kind of like a menu of some of the local models that we do have out there. We have basically a model with rebuilding New Orleans, where we have basically pretty much a grantee that is going into houses that have been affected by the hurricanes, and they're doing not only the repairs of the hurricane, but also modifying the house so it can be more accommodating for someone that needs those accommodations. We also have a grantee that deals with hoarding and the mental disorder relating to that, and having volunteers kind of learn how to help people in that particular area. We also have I thought it was kind of unique, we have a conversation group grantee where there's a group of adults that basically pretty much have a lead speaker each week for 1 hour. And believe it or not, they even had someone that taught them how to knit, on the phone, with basically pretty much a large group of people listening. So just wanted to kind of give you a flair of that. We also have transportation services. We have Meals on Wheels. We have a lot of students that are actually coming into the homes and doing different services, be it inside the home or outside the home. So those are just a little menu of some of the types of services that are being provided, in addition to these 5 agencies that provide respite. So the 5 I'm going to highlight is Advocates out of Massachusetts, Family Means out of Minnesota, and Hospice of the Valley out of Phoenix, Arizona, Living at Home Network out of Minnesota, and Volunteers of America out of Colorado. So let's go to the next slide. So let's talk about advocates. They provide respite for family caregivers. Advocates have a program called Caring Connections Across Communities, which is a collaborative project across multiple urban and suburban communities in Massachusetts. Their goal is to reduce loneliness and social isolation among older adults and adults with disabilities. They have piloted 2 projects, one in Boston and one in the Metro West Greater Boston area, to recruit volunteers and care recipients from the Metro West Boston of African immigrants and refugee communities. And in this particular project, volunteers create connections with care recipients. They help them with their day-to-day tasks. They encourage them to use virtual community activities, and overall decrease the feelings of loneliness and isolation. They also have a separate program where they provide respite for family caregivers to provide them a needed break from their day-to-day caregiving activities. So that's Advocates out of Boston, Massachusetts. This is their first year as a grantee. And I wanted to give you a little flavor that there are grantees in Community Care Corps that do provide respite services. Would you like to add anything to that, Nichole, regarding advocates?
No, I think one of the things as we're going through these programs, I think another thing to keep in mind, and maybe, Derrick will have an opportunity to talk a little bit about this at the end. When we're talking about the services that these programs provide, respite can often fall into kind of like an indirect benefit to the family caregivers, having individuals that are spending time with their loved ones, either by coming in and having these friendly visits, doing virtual kind of check-ins, kind of the whole gamut. That's creating opportunities for respite often for the family caregivers. So I think that's important, just as we're going through some of these programs and we're talking about their services, that while these programs in particular do kind of have a focus on respite as part of what they do, many of the other programs that are part of Community Care Corps do provide respite services, but more times than not, they're going to fall under that indirect kind of benefit to the family caregiver.
Thanks, Nichole. Okay, Jill, you can move to the next slide. Okay, let's talk about Family Means. Family Means is a program that served the eastern part of Minnesota, Twin Cities. And they have a caregiving and aging program that supports caregivers. And they have launched an in-home respite program for caregivers. And this involves a multi-service model, meeting caregivers and care recipients at all points of their journey. Services include caregiver coaching, individual and group respite, support groups, education outreach, and dementia empowerment programs. In the future, they also plan to enhance their volunteer services to meet the community needs for respite, and they plan to expand with a new evening respite option moving forward. So that's something that they're looking to kind of do with that. Similar to what Nichole has said, on a monthly basis, we have monthly calls with all of these grantees, and they have work plans, and we kind of go through each of their work plans and some of the things that they've accomplished, some of the challenges that they have, and some of the things that they need to work on moving forward. So the Family Means grantee is one of those that we think are doing a good job, and like I said, they provide respite for their community. Nichole, would you like to add anything to Family Means?
Sure. So Family Means is, I think, a really great grantee to kind of talk a little bit more specifically about kind of the respite services that they provide, or how it kind of is shaped into their program. And Derrick kind of described it a little bit. So they provide in-home respite, meaning that they're going into the homes and spending kind of this one-on-one time with the clients or with the care recipient. And a volunteer will provide this service for 2 to 4 weeks. And this is kind of companionship and care. And that's a little bit about the in-home, but I want to talk a little bit about the group respite, because I think this is something that's really kind of cool and interesting. So the volunteers in the program will bring individuals to the Family Means building, and they're going to participate in a number of different activities so that that caregiver can have respite and, run errands and things like that. Now, in addition to kind of this event, which I believe happens every Friday for a couple of hours, they also have a virtual leg of the kind of group caregiving activity that runs about 90 minutes. And so some things that are occurring in these kind of group respites, you've got conversations, singing and songs, you've got some exercise programs, games, For the virtual in particular, you've got some dedicated tech support to be on hand for troubleshooting, because even though so many of us have become really familiar and acquainted with using all forms of different kind of virtual means to stay connected, technology can always be a little bit of a bear. So they have some really great staff on hand to help individuals that want to connect to these virtual opportunities. They can do so pretty smoothly. And I think one of the cool things about having this virtual component available is it helps individuals that may have mobility issues. So they're still able to participate in something, have that engagement, that social activity as well. In addition to this, kind of in that same vein as the night out, as the group day out program, they have a night out one as well. Very same idea, and that's once a month. So not weekly, but once a month for a couple of hours. So again, really giving those family caregivers that break. So I just wanted to talk a little bit more specifically about their program, because I thought it might be kind of interesting to delve into.
Thanks, Nichole.
Mhm.
Okay, Jill, you can go to the next. Okay, the next grantee that we're talking about is Hospice of the Valley, and they service the Phoenix, Arizona area. And they have a supportive care for Dementia Partners program, which engages college students to provide non-medical respite assistance for older adults with dementia, and the family caregivers that basically kind of support them. This program helps persons with dementia, not yet in hospice, to maintain independence in the home. They work with some community colleges in their area, and they recruited and trained these students to provide weekly non-medical respite visits to care for the recipients and give the family caregivers a respite break. This is kind of a unique grantee. They provide their students with an incentive that includes a monthly stipend and a scholarship opportunity. So I think that's kind of unique, and we were able to kind of let them approve that particular aspect of their project. And we think that's pretty interesting, and they're getting a lot of students to kind of be involved in helping out. The goals for this project is to reduce the family caregiving burden and improve the quality of life for the persons with dementia. So Nichole, would you have anything to add to Hospice of the Valley out of Arizona?
Sure. I think there's some interesting things about this program. Like Derrick said, this is engaging volunteers, which a number of the C3 grantees do this as well, but they engage college-aged volunteers by partnering with local community colleges and universities. One of the things that we have really unpacked as we've been having these conversations with all the grantees, and as we've been kind of, monitoring these programs through the duration of their time as grantees, we've really understood that the intergenerational component is really, really, really beneficial and a really exciting element to kind of come out from these projects. So many of the volunteers have shared stories about how it's been really great to be able to sit down with someone that's, a little bit older, learn about, kind of their life, what their interests are. It's really been kind of an eye-opening experience for them. And the same for the client or the care recipient. So that's something that I think is really a great aspect of this program in particular. I just want to also mention that as of April of this year, the volunteers that they had have provided 150 visits kind of over the grant cycle thus far. And that's averaging about 3.5 hours each per visit. So that's equating to just over 500 hours of respite services for those family caregivers. And I also wanted to share just kind of a quote, a story from one of the caregivers that they shared as part of this program. Having a volunteer for my mom allows me to spend time with my children and grandchildren. I've been able to go to my grandchildren's soccer games. Soon I'll be going to their baseball games. And recently I was able to go to a concert with my daughter. My siblings are out of state and are not able to help with care. The volunteer supporting my mom allows me to leave the house and take care of myself while knowing my mom has that companionship at home. So I just found that to be such a really wonderful illustration of the impact that these programs are having for family caregivers. And obviously, while this applies to this specific situation, there are many family caregivers that are long distance family caregivers, and being able to know that someone is there spending time with their loved one helps them feel a lot more secure, safe, comfortable, and just happy knowing that there's someone that's taking a part and interest in their loved one's life.
Okay, Jill, next slide. Okay, the next grantee we want to highlight with respite services is Living at Home grantee. And they're out of Minnesota. And their model draws volunteers from the community to help older adults remain living independently at home by addressing social isolation. They help out with transportation and other unmet needs. The volunteers provide caregivers with respite visits, rides, chores, deliveries, and more. The model uses the approach of local ownership to stimulate neighborly caring by the volunteers. Their caregiver respite visit is one of the primary services that this particular program provides. So the Living at Home grantee out of Minnesota, another respite project that provides that particular service. Nichole, would you want to add anything to Living at Home grantee?
Well, the only thing that I would emphasize here is the transportation piece, which again, many of the grantees will have a transportation piece, helping individuals get to and from medical appointments. A huge aspect, a huge point of relief for a lot of caregivers, because if they're working, if they're not able to be with their loved one to take them to an appointment, it just allows a lot more flexibility, a lot more comfort for them to know that their loved one is able to get to these appointments. And many of these transportation programs aren't just kind of like a to and from, but also really making sure it's kind of like door-to-door service with a little extra. They're making sure, for example, if I'm going to a doctor's appointment, they'll make sure that I get to the appointment. So making sure I get into the car, make sure if I need some help getting to the vehicle, all of that, they're there for that support. They'll make sure I get to the appointment. So, if you go to a large hospital and your appointment is on the 6th floor, maybe it's the first time that you've been to this particular office, you have no idea where you're going. They have a volunteer that's going to help make sure that that person gets to where they need to be. And then on the flip side, make sure that they get home as well. And then that volunteer can provide those updates to the family caregiver so they know that they're going to their appointments and that everything is going really smoothly. It's just another thing that we often don't really think about in terms of, that being kind of a need of respite as well. The time that's spent taking loved ones to and from appointments can be really, really difficult to manage, and this makes things a little bit easier. So yeah, that would be the only thing that I just wanted to emphasize with this program.
Thanks, Nichole. Okay, Jill, the next slide. Okay, Volunteers of America out of Colorado. This is the grantee. This is their second year of funding for Community Care Corps, and they provide in-person and remote respite visits. Volunteers of America, they service the northern Colorado area, and they provide volunteer respite visits both in person and remotely to family caregivers caring for older adults at home. They are providing a weekly reliable break for the caregiver and a friendly social connection for the older adult. Their caregiver support program goals are to increase caregiver resiliency, improve the care recipient's social connectedness, and ensure meaningful experience for the volunteers. They serve an urban, suburban, and rural community, including a very rural and underserved counties in northern Colorado. This program has been doing a really good job in this particular area, and so much so that we thought to refund them again for a second year of funding. Nichole, do you have anything you want to add to this particular grantee?
Sure. So one thing that in sitting in on the site visit with them, learning a little bit more about kind of the makeup of their program, the logistics of their program, one thing that really stood out to me, and again, something that I think is kind of pieced into many of the grantees, but really stood out here, was a matching process. So when we're talking about the volunteers, this program allows volunteers and clients to kind of match in a really kind of organic and authentic way. To kind of explain what that is that the Volunteers of America will have a volunteer that wants to provide some, in-home visits, things like that. They will present that volunteer with, maybe 5 bios, just these really kind of short yet detailed bios that really give a picture of the individual. And they can kind of go through, there's some things it talks about, what the client likes, their interests, can really be as all-encompassing as it needs to be. But a volunteer will go through these bios and will pick one. They emphasize that they only want one person at a time, a volunteer to have one kind of person at a time that they're, doing these in-home visits with. So I felt that was a really unique aspect to the program, just a really unique kind of matching there. During the site visit, they actually had a volunteer and the individual that she goes and visits, as well as that individual spouse. And it was a really great conversation with them because the spouse was able to say, this has been really great because this person has been such a great match for us. They come in, both love to read, the volunteer and the client are both really big readers. They like to have these kind of conversations about current issues in the news. So they'll go through the newspapers and read articles together. The wife helps out by, maybe setting aside a few, like in the Wall Street Journal that she thinks would be of interest. And it was just a really kind of unique way that they had formed these visits. And the spouse really spoke to her experience, saying that it was really great to see just how much joy these visits were bringing, to her husband, but in addition, it gave her time. She's like, now I can go on a walk and do some exercise, or I can run to the store. I now have this built-in me time that I didn't necessarily have before, and I can still be in the house, I can still be around, but it's time that I don't necessarily have to be right there. So, and he's kind of doing his own thing. And so it was a really kind of cool thing to hear a really specific example of that at play.
Okay, Jill, next slide. You want to take this, Nichole?
Sure. So we have talked a lot about respite, which is obviously such a key component to not only the programs that we talked about, but so many of the other grantees that are part of the Community Care Corps group. But I also wanted to, touch on some of the other services. When creating the grant program, we really struggled with the question of whether or not we would provide examples of the kinds of non-medical help grantees could provide. Because remember, we are really looking for innovation. We feared that if we gave examples to applicants as they were coming through, that it would kind of go against that. So to a certain extent, that is kind of what happened. But since the grantees are serving their particular community, we got to see some creative modifications of some of the examples that you see here. So again, it was, not wanting to be prescriptive of the kinds of services and how these services were implemented. And while we saw some coming in that, were very streamlined, we were able to also see how they were being innovative and interesting and really touching on the need of their community. So meal prep, mentoring, minor home repairs. So I think briefly mentioned programs that are doing, home repair and maintenance in, places that are impacted by severe weather events, things like that. So it's been really great to see how these volunteer services are, while we know that these are important volunteer services kind of across the board, we've been able to see that there's a lot of innovation within kind of these categories as well. So I think that's something that's, we're continuing to learn through these ongoing conversations with the grantees. Next slide. And so I'll talk just for a second about Storyvine. So Storyvine is an app that allows individuals to record a story. Basically, it's a template. So you can use it on your phone. You can use it on your computer. It's a program. It's very easy to use, especially as we become, I think, a little bit more adept with, recording things on our phones over the past couple of years. So you can go in and, you'll get a prompt of different questions to respond to. Then the app will kind of sew everything together and make a really, really kind of cool little video that sews all of the questions together, and it just really speaks to a story that is being told. And so this is a way that we have been able to help these grantees get the word out about their program. So we created a template in Storyvine asking, I think, 4 questions about the program, how they're impacted by the program. We have basically 2 templates that are related to Community Care Corps. One is specific to the volunteers and the recipients of services. So, the recipients themselves, or it can be a family caregiver. And then we also have a template that is for the subgrantee, the organization themselves. So they can talk a little bit about the collaborative nature within C3. So it's been a really great opportunity for them to create something that's really kind of cool to share about their program. Derrick, I don't know if you had anything else that you wanted to kind of speak to around Storyvine, how subgrantees have been using Storyvine.
Yeah, I think I would just add that when we first started this, a group of people would tell us that they weren't really that tech savvy and they didn't know how to do that. And we put on some trainings for them, and they were able to kind of basically pick up on that. And some of them then began to start making numerous videos and started marketing that out into their communities. And they've been getting a lot of positive feedback for that. So I just think it's kind of evolved, and it hopefully will continue to evolve with the new applicants that we bring on board moving forward.
Yeah, and I would just also add on to what Derrick said, that there isn't like a cap of how many people can submit a story. So if an organization has, let's say, 6 volunteers, all 6 can record a Storyvine. If there's like 15 people that those volunteers are providing services to, all of them can record a Storyvine. And it can be self-recorded. You can have, someone there that's helping with the recording. It's a really kind of cool program that is really, I think, adaptable to, how it works best for you. Some people I know, it took me when I first got it, it has changed quite a bit since we first started using it before Community Care Corps. It used to be only something that you could record on your phone, and that's not always really super intuitive for people. Because you record something, you don't know if it recorded, can be a little confusing. So now that we can also record on the computer, it's made things a lot easier on that front as well.
Nichole, I would also add that when we have seen some of the Storyvine videos from care recipients, those have been very impactful, where they can honestly tell, the benefits that they've received from the services from the grantee organization. They can be pretty impassionate about, how they weren't able to do this, and someone came to kind of assist them, and, they can really kind of tell their story in a real compassionate way. So I think that, it's not just the volunteers, but the care recipient videos have been very impactful and been marketed out into the communities to kind of see the impact that the program is having, directly and then broadly in the community.
Right, exactly. All right, next slide.
Okay, so in Community Care Corps, in order for us to basically keep data for this particular project, we have an organization that's a partner called Alterum, and they provide the various surveys online and the paper form. And we have pre-surveys for both volunteers, caregivers, and care recipients, where we pretty much get a baseline of what their needs are, what basically pretty much they are experiencing prior to the service being rendered. And then we have post surveys that we have them to complete, that then speaks to what they have benefited from and what has improved since the services have been provided to them. So we're in the process of basically pretty much tabulating all that data. And at the end of this particular project, we will have that information available publicly for everyone. But the information is, at times, it's a little difficult to kind of get. We've had to find innovative ways to keep people involved in answering those particular survey questions. Initially, some people were a little reticent to share some of their information. So we had to kind of, use different techniques to give people to provide, this information. But now it seems that we're pretty much on track for gathering that information. Once people realize that it's important information, it's almost like paying for the service just by doing the survey. They don't have to pay any money, but provide pretty much the impact that the service is providing for you. And then that's kind of pretty much one way that we're encouraging people to complete the survey. So we're getting good information from the surveys now, and hope for that to continue. Would you want to add anything to that, Nichole?
No, I mean, I think one of the things that we've learned from the site visits is that, I mean, the pre and post surveys have been really, really, I think, important, and obviously kind of tracking the impact of these programs. But being in on the site visits has also been really informative in letting us know some of the challenges that folks have in completing the pre and post surveys. So, it's definitely, when we think about all of our kind of overall lessons learned, this is definitely something that we're continuing to figure out, kind of best practices to make sure that we're getting as much data as possible.
Okay, next slide.
All right. Well, I just want to hit on some, speaking of lessons learned, some lessons learned related to kind of the programming and structures of some of these programs. So as you can see here, these are kind of general lessons learned that we've been able to piece out through, like I said, these site visits, some of the data that we've captured. So assessing the environment is one that I especially want to call out, because I think there's kind of a two-pronged piece to this. One is knowing the community that you're serving, understanding the needs of that community and the gaps. So being able to kind of sew everything together, figuring out where you fit in terms of these services, I think is really important. And the grantees have done a phenomenal job with that. The be adaptable. When we talk about respite care, and when we talk about how respite kind of played into some of these particular programs, as I think Derrick mentioned towards the beginning of the presentation, so many of these grantees had to shift kind of focus because they were having kind of, these in-person events. They were having folks going into homes, but with the pandemic, things had to change. A lot of stuff had to go virtual, online, and so the grantees have done a really, really wonderful job at really laying out all of the ways that they had to adapt their programs, because I think a lesson learned, I think, for all of us is that, a lot of these things are things that are just going to have to continue moving forward. It's great to have those virtual and online options, even if the pandemic isn't posing the same kind of risks at certain times. Having those opportunities is really useful for folks that may be immunocompromised, be at higher risk, which a number of individuals served by these programs may be, as well as, folks with mobility issues. So you're really running a gamut there that I think is really important. And so we've been learning about kind of the adaptability of these programs. Kind of connected with assessing the environment, integrate the program services into community infrastructure. One thing that we all know is it's never, it's a lot harder to reinvent a wheel than it is to really figure out how you can kind of plug into what's already there. How can you expand on something? So integrating those program services into community infrastructure has been a really key kind of component to what we're learning from grantees. Secure community support. A lot of the efforts and services of these programs are kind of a collaborative of different community partners. One that comes to mind is I think it's rebuilding together in New Orleans. So doing home repairs and such in an area of much need. They have been partnering with different community organizations to make sure that they have access to the proper tools that they need, materials, storage, things like that. So it's really important to make sure that when you're putting these programs into place, that you're also locking in those partners in that community support. And kind of, I guess, part and parcel with that is creating those strategic partnerships. This is both just a great idea in terms of overall program design, but also sustainability, and being able to replicate these programs in different communities across the US and other areas. And then secure diverse financial opportunities. Again, that really speaks to sustainability. So yeah, we're continuing, I think, to learn more and more lessons, because the past couple of years have been a really kind of complex time for these programs. And so we're continuing to kind of go with the flow as they kind of adapt to their community needs and how they can serve them safely. And we're continuing to kind of piece all those things together. Next slide.
Okay, so to kind of touch on what Nichole just ended regarding diversifying funding sources. The Community Care Corps is a one-year grant for each one of these grantees. So it's not guaranteed that each year you're going to get refunded. So from the very beginning, when we start working with these grantees, we want them to find, new and different diversified funding sources from federal, state, private, and in-kind support. So we kind of emphasize that from the very beginning. And we have some that basically pretty much have done very well with that. In fact, we have a particular grantee that since they started, they have kind of moved not only from the area that they're in, they moved into 2 additional states, over the time that they've been in Community Care Corps, because they've been able to market their program. They did a ton of storyline videos and put it out in the community, put it out in the various communities in the states that they expanded to. So it's really been an area where if you diversify your funding, market your particular project program, there's a lot of benefits in doing that. The second area, communicate regularly with stakeholders. You all are familiar with that. Doing this on a regular basis, joining partnership meetings and similar to what you all are doing every 3 months here, meeting, networking, and getting the word out to key stakeholders. Form partnerships with like-minded programs. I know you all do this with just meeting in this particular forum. That's something that we recommend, and we recommend that to the grantees. Anytime you can have an evidence-based project or service that basically is able to prove its outcomes and of the service and that is making an impact, that is always something, strongly to consider. And we tell the grantees, begin from the time you receive the grant to be thinking about other ways to be funded and sustain this particular project by not only receiving the federal grant that we provide for them, but also, in the broader community where they live. So that's basically all we have right now for our presentation. Oh, well, the next slide, Jill, I'm sorry. I would just say that as of this year, ACL has now funded Community Care Corps for a 3rd year. And we're in the process right now in the month of August reviewing new applications for the 22-23 cycle. And that particular review and selection process should end by the September 1, and we should be making an announcement of some of those particular selectees for the year 2022, 2023 moving forward. So that's a good thing. We're doing good work. We believe we're doing good work, and we believe that the grantees are providing a very needed service in their community. So with that being said, if there's any questions or any comments, or Jill, would you like to add anything at all to what we just said?
I just want to thank you for a really excellent presentation. We learned a lot about what is happening with CareCore. I know I have a lot of my own questions, but I'm going to open it up to the network first. And there's already one that's appeared in the chat that I know is on the forefront of probably everyone's mind. And I know they'd like to hear more about these grantees, particularly around recruitment efforts. And if you've seen any unique and successful strategies to recruit volunteers, because that's always a huge challenge.
Sure. So I think a lot of that goes back into, those community partners. So if you have different organizations, nonprofits in certain communities, I know that that's been really successful, especially those volunteer-based nonprofits, colleges, like I mentioned when we were talking about one of the grantees in particular, community colleges getting, students that are interested in specific and related fields like social work, some healthcare fields, things like that. So there has been a lot of innovation, some churches and places of worship. You have folks that are going to different community events to recruit. So different kind of like fairs, things like that. Those have been really successful. And then some of the traditional methods as well. So, some kind of volunteer portals that are online, and some kind of like advertising online as well through social media. So it's really been a mix, but it's one of the great, I think, benefits of having these organizations be so kind of embedded in their communities, because it builds that trust. And so folks know that by volunteering with this, with these programs and these organizations, it's going to be a really enriching experience. And there's, trainings and further education opportunities that can come with volunteering with these programs as well. So it's been really interesting to see how, the different sub-grantees have approached it. And there are definitely some where recruitment has been a challenge, especially amidst the pandemic. It's been a real challenge to have folks that, can do specific services. So it's really run kind of a whole spectrum, but there have definitely been some really cool and innovative approaches to recruitment.
In those states that did face significant challenges and continue to face challenges, are there any strategies that really stand out in your mind as being particularly useful? A lot of our grantees are doing the student-run volunteer programs, so they're quite knowledgeable about that as a strategy. But are there any other strategies, especially from those grantees who have said they've had difficulty?
Well,
Go
go
ahead.
ahead, Derrick.
Well, I was just going to say that I know that in some local communities, because the pandemic, did not allow people to kind of meet, they were finding ways to basically have a lot more meetings, either virtually and even when it opened up in person, to kind of basically kind of let people kind of know that they're still around, let them know that there is a need for volunteers. I'm sure you all have done that, but it seems that also what Nichole was saying and what you also said, Jill, is that they've been tapping in. Students seem to be the big number of folks that you can engage, because they're right there at the university or a community college, if you establish those relationships with those universities and community colleges, they have an ongoing way of kind of connecting, the departments in their colleges to basically students and letting them know that there is a need out there in the community. And a lot of times they're more eager to learn and want to, hear senior stories about what they've done and those kind of things. So that's been a untapped, well, it's been a tapped in market, but I think that's an area that you find a lot more sometimes willingness to volunteer and learn more about, seniors and some of the things that they're challenging.
I would say that another kind of component to that, going away from the students, although students would certainly kind of fall into this as well, is incentives for volunteers as being a piece of that recruitment. So while gas prices continue to go down, that's really, really wonderful. But with so many programs that have transportation components as part of them, that was such a struggle, especially when gas prices were, extremely, extremely high. So, they were giving these volunteers gas cards, helping them out in any way that they could, so that it wasn't deterring folks from continuing to volunteer, so that retention, but also in bringing other people on board. So, going to like those community, job fairs, or colleges going to those job fairs, or volunteer days, and being able to say, yeah, it's transportation, gas is really expensive, but we can also offer you a gas card that will help a little bit. So yeah, that's been, I think, another kind of piece of that as well.
Thank you. That's very helpful. We have another question here about Storyline. The question is this offered as a subscription service? How do people access it?
So that's a great question. And it's one of those services that is kind of different depending on how you're going to use it. So the more that you really want to build out, customize, it's, for example, for CAN, we have kind of a service with them where we can build, these different templates for different programs, including community care core, but beyond that as well. So, but there's no subscription, there's no cost, there's nothing else for individuals that want to use it. All they need to do is go in, enter their email address, and kind of follow some pretty straightforward and simple prompts. We've been using Storyvine now, I want to say since 2018. And it's been really great. We took it, we used it initially when we would have these in-person workshops and trainings to capture caregiver stories. And so we would find these breaks in the day where I would set up a little tripod and, I would be the one asking the questions, and it worked really well. But us being able to go in and create these different templates, I think makes it a little bit more organic feeling and really makes for some really powerful videos. So no, by signing up, people can go in and record one video and never worry about Storyvine again. It's not something that you have to pay for. It's not something that you have to use so often. But yeah, no one has to pay anything in terms of the volunteers or the care recipients to use it.
That sounds like a wonderful tool. We're going to have to explore that a little bit more. Thank you for sharing that. We had another question about whether or not there were opportunities for volunteer programs to get involved with Community Care Corps if you're not funded by Community Care Corps.
I'm sure that we would take all the help that we can get with regards to volunteers. I would say basically kind of just get in contact with us. We'd like to hear, that proposal. Right now we do have people working directly with us, and indirectly, just through partnerships, I'm sure that that's something that could probably be done. But I think we'd have to handle that on a case-by-case basis. But normally it's people that have been selected, and then they pretty much are then providing, the volunteer service. But I think each particular situation can be looked at on a case-by-case basis, and there may be some opportunity to work in that area. But so get in contact with us. We can leave our contact information with Jill, and we can get back to you on that.
Yeah,
I hope
and I
that
would-
answers your question. Oh, go ahead, Nichole.
Oh, and I would just add, it speaks to kind of what we were talking about in terms of, building these strong community collaborations and networks. So, certainly the grantees have a number of different partnerships that kind of fall within kind of different areas that, they're not volunteer programs that are funded by Community Care Corps, but they're still kind of a partner. They still work together and collaborate. So to what Derrick was saying, if you have any questions you want to know about, programs that might be in kind of your area that you would be interested in reaching out to and seeing if there's any kind of way to engage, I think that would be wonderful. We'd be happy to kind of point you in the right direction.
Let me also add to that point. The reason why I was not quite sure how to answer that question is that when you're part of this particular Community Care Corps project, you have to agree, if you are directly working with older adults, that your volunteers have been vetted and screened, and in some cases they have background investigations, if just general background investigations as it relates to working directly, without supervision with a senior. So that's why just any volunteer program without any kind of supervision, if they were working directly with a care recipient, that wasn't under the same guidance of the person that's working with Community Care Corps, that's where it would be a little gray area there.
What about training opportunities? Do many of these programs require training of their volunteers, and do they use a particular training curriculum?
Yes. Each particular grantee has their own, in fact, they're required to have a training program for their volunteers. And they basically pretty much will have a training program specific to the service that they're going to provide for their care recipients. And basically pretty much that's something that all of the grantees do provide. So yes.
And I would say that some of these training programs, because we have such a diverse group of grantees, so for example, if it's a Meals on Wheels program or a Meals on Wheels organization that's providing the service, they have kind of a toolkit, a training toolkit for their volunteers already in place. Others, have had to put together stuff that's training their volunteers, because as Derrick spoke about, because of the nature of the program, individuals need to be trained, they need to be vetted. We want these programs to operate in a very kind of safe manner. So yes, all programs have a training component, but some are part of kind of a bigger model. And so they have a training, they kind of came equipped with a training kind of protocol in place, and some have had to kind of build on what they're doing and create something. So that's been really kind of cool to see, and it's something that has been really key in the sustainability piece, because obviously we want to be able to have that be part of the replication process.
Would you be able to, by any chance, provide the training that the Respite programs are using? Do you have that information?
I think we can provide that to you. Yeah.
Yeah, I think that would, and again, we'd be happy to share our training modules too. That we're currently field testing a respite provider training in 11 states that's not just for volunteers, it's for paid respite workers also, but we could certainly share resources around that topic that might be very helpful to both of us.
That's great.
Yeah, that would be great.
Anyone else have any other questions? Feel free to unmute yourselves too if you'd like to ask a question. Well, I have one more question, and that Derrick and I were chatting before the presentations began, but I know that you all did an independent study, I think, on some of the more interesting findings that have been emerging around outcomes for family caregivers and family members as a result of these interventions. Are you able to share any of those at this time?
Joe, I could kind of tee up a little kind of intro to that, but I don't have all the detailed findings that I could present yet. It's in the process of being reviewed at this point. But Community Care Corps, well, let me just back up. ACL asked Community Care Corps to do a special project to look into the indirect benefits for caregivers from this program. Obviously, we have direct services that are provided for caregivers, but we basically have a lot of services that are directed to care recipients. So we basically pretty much took out a designated number of grantees, and we had them identify caregivers in their communities. And we took some of those caregivers and we developed a discussion guide that basically had numerous questions to get to the core of some of the things, not only the benefits that they were receiving or not receiving, but we also basically pretty much used a survey for caregivers to basically kind of pull out some of that particular information. So we were able to interview a number of caregivers. We were able to kind of get a sense of what they thought when people came. I think what was basically being said, the theme was, even though a volunteer may have come into the home to help the care recipient, indirectly, the caregiver was receiving a benefit. Similar to what you all do with respite, when basically a student or an adult volunteer would come in, there was some ability for that caregiver to have some respite, some breakaway, knowing that the volunteer can engage their loved one and then give them kind of a break. There was also some benefits that we found, and we'll put together a report. And Jill, since we basically are going to be in contact with you moving forward, there's a lot of interesting information that we're going to be able to provide folks with regards to that. So we haven't done we have a draft of the information, but the final report is in review, and then we're going to disseminate that once it's reviewed and approved.
Well, that's wonderful. We would really love to see that. We have quite a bit that we've done around documenting an evidence base for respite. So especially any outcomes that relate to the respite piece, we would be very helpful to everything that we're working on. So thank you very much for your willingness to share that. And we only have a few minutes left. And I know that Nichole and Derrick would love to hear from you too about any of your volunteer and faith-based efforts. If anyone has a quick update they'd like to share about anything that you're doing in your state in this area. Anyone have anything they'd like to share about your own efforts? Too close to the end of the hour, I think. Okay. They all are doing some really wonderful things. So we'll have to get offline and I'll have to tell you about everything that they're doing. And I know a lot of them are here to also learn as they're moving into this space as well around respite, engaging the faith and volunteer communities. Again, I want to thank Derrick and Nichole very, very much for taking time out to share what's going on across the country with Community Care Corps. And it's very exciting to hear about all these new initiatives that provide such a breadth of comprehensive and needed supports for older adults and people with disabilities and their caregivers. So again, I want to thank you both very much for your time today. And I hope the rest of you all have a really wonderful afternoon, and stay tuned. We'll be sending the link to the recording of this event out in the next few days. So thank you all very much. We'll see you soon. We'll hope to see you in Madison in September.
Thank you very much.
Thank you again, Derrick and Nichole. Thank you.